missing in the treatment of pelvic floor dysfunction is the actual chasing the why behind the presentation. First of all, you have to understand pelvic floor dysfunction is more than incontinence, more than pelvic pain, more than pain during intercourse or painful sex. It is more than fecal incontinence or urinary incontinence. Anytime that you have a history of chronic lower back pain, chronic sacroiliac joint pain, chronic hip mobility issues, if your posture is weak and you're kind of slouch forward, you automatically have instability of the pelvis, and that is pelvic floor dysfunction. The reason I say that, and the reason I want you to look into this further, is to understand that when you have instability of the pelvis, the outside and the inside of the pelvis have to work together for a stronger foundation. So if the inside of your pelvis has to change its tonicity of the muscles to become tighter, to become weaker because parts of it you don't use, that's a reflection of what the story behind your pelvic stability is. So for us to go in through the anus and vagina to try to access the muscles inside, to loosen the tight muscles, or to practice strengthening them by coordinating the pressure that we feel on the finger as we're asking you to do certain things, that to me does not make sense, because that does not address the reason why it happened. Now bear in mind, the why does not have to be an incident. So for example, you may think that, okay, well, I was pregnant and that is why the muscles inside my pelvis are weak. Well, pregnancy is the incident, but that does not describe why it became weak. How is it that some women don't have that issue? How is it that there are plenty of men that have that issue? So clearly they didn't give birth to anyone. So when you start chasing the why beyond the incident is when you actually start being busy looking at the cause of the issue. Therefore, you addressing the solution is a shorter path, because you could be distracted doing other things when these other things are not necessarily the main things that influence the health of your pelvis muscles on the inside. So just wanted to bring that to your attention, because I think in the world of pelvic floor therapy, the stability of the pelvis, the stability of your movement, the functionality in your movement are not necessarily addressed or looked at as much. Of course, there is some degree of breathing that you're being coached on, but those things are hardly ever being addressed. And in my opinion, they should be addressed first. Why first? Because you stabilize the house that pelvic floor is the floor of. You would not be attending to the floor when the walls of the house are unstable. I hope this makes sense. Thank you for watching and subscribing. Take care.